Welcome to the American Institute of Healthcare Professionals video on RAD, or Reactive Attachment Disorder. And in this video, we're going to identify what RAD is, some of the symptoms of it, and some ways to help individuals who have this type of particular attachment disorder. So reactive attachment disorder, or RAD, is a type of attachment stress trauma disorder that later usually manifests in adult life, but it can be identified in early childhood and adolescence through a variety of things. But the primary issue is due to poor bonding that goes back to early childhood development, like any type of attachment disorder, whether it's an avoidant or an anxious. RAD instead is a reactive attachment disorder. And this particular attachment disorder makes it difficult for the individual to form healthy and loving bonds, and as well to express emotion in a healthy way. So it really isolates an individual and causes dysfunctional relationships because the person is reactive. They're pushing love and intimacy away itself. So many with RAD will flee healthy relationships in their adult life, and they'll also have difficulty expressing their emotions or being intimate with their particular partner. So again, it's important to diagnose at an early age so that the symptoms do not become more extreme in adulthood itself. So let's look at a few causes and symptoms of this. Usually, it starts to occur in early child development, and that's due to poor caregiving and the needs of the child are not emotionally met. Think back to Erik Erikson and just that first thing of trust versus mistrust that a young human being encounters. Are their needs met? Is trust able to be manifested between the caregiver and the child? Due to emotional neglect, inconsistent care schedules, frequent attachment disruptions, maybe through abuse or divorce or change of homes, and tougher social environments without stability. Maybe a child goes through a lot of foster care and homes that reject them. These things can cause a reactive attachment disorder that begins within the child through adolescence and then fully develops as an adult. So when we look at younger children, it's important for teachers, for therapists, for caregivers to see if healthy bonds are being formed with their connections with their peers. How are the children interacting with each other, or in this case, the particular child? Does the child have higher anxiety levels? Now, this can lead to a lot of things, but it is one symptom to look for when we're looking at RAD itself. Is there a lack of trust instilled within the child or adolescent with other caregivers that might be watching them and themselves? Does the child appear isolated on a consistent basis and withdrawn from groups? Again, it can be many things, but that is one of the things that, if you start adding things together, equate to reactive attachment disorder. Now, in adulthood, these things and attributes intensify and create, as we pointed out in the previous slide, problems for having healthy relationships themselves. Now, diagnosing and treating, again, we look at those symptoms. The DSM-5 gives a robust list of symptoms to watch for to see if an individual potentially has RAD. RAD is also closely related to disinhibited social engagement disorder. So, in all these things, it makes it difficult for the adult to engage, to be an extrovert, to engage healthy in a relationship, to want to be committed in a relationship, to have trust in that relationship, and to be able to display emotion and to give that emotion not only to your partner, but also to one's children. So it's very important to help children and adults form healthy bonds. And with dyadic development psychotherapy, it looks to help children form healthier bonds by inserting trust and forming a trusting environment in therapy that's then carried on to the home. And the key of this type of psychotherapy is to build a bond between caregiver and child. So if a child has gone through foster cares and through homes after home and comes from an early trauma, maybe with their birth parents, then this type of therapy is important to be employed at an early age to try to counter the damage that has possibly been done. Now, with adults who are already exhibiting RAD behavior, it's important to discuss the past, to revisit the trauma of youth and early childhood, and to help give the tools necessary to build new relationships and to understand trust. It's important in these types of therapy to identify feelings that are associated with RAD. Again, individuals with RAD don't like to discuss emotional things. It's important to bring out those emotions to discuss so that they can be felt and experienced and then properly shared beyond therapy, but with others. So it's good to build on these values and then to associate them and insert them into their current relationships itself. Again, early intervention is key because adults are a lot harder. Just like that whole idea of a tree that can bend as a sapling, but once it starts to get its roots and its firm trunk, it's harder to change individuals as they grow older. It's not impossible, but it's more difficult, especially when we're dealing with these types of attachment disorders, especially in the case of RAD. Of course, therapy and medication can help an individual, and individuals who are willing to accept the fact that they have an issue and they take their mental health serious, there is hope and there is an ability to foster new relationships and restore older relationships as well. We are the American Institute of Healthcare Professionals, and we offer a wide variety of behavioral health certifications. Our link is below. Our phone number is 330-652-7776, and our email is info@aihcp.org. I'd like to thank you for listening and also have a good day.